For decades, ear infections were the most common reason for parents to bring their child to the doctor. Fortunately, that trend seems to be on a steep decline. A new Harvard University study of CDC statistics reveals a dramatic increase in ear infections between 1975 and 1990, followed by a dramatic decline of almost 30% between 1993 and 2008. Harvard researchers suspect that a significant reduction in children's exposure to secondhand smoke has played a significant role. We talk with specialists at Lake Ear, Nose, and Throat.
Frequently, children have ear infection problems, and this can be related to acute infections, but also it can be related to having fluid behind the eardrums causing hearing loss. One of the major risk factors for ear infections in a child is smoking in the household. That also applies to other medical problems in children such as asthma and allergies as well. The severity of the ear infection symptoms, as well as how frequently they arise, and also how they respond to medical management, tells us when and if we need to do surgery like place ear tubes. Children do outgrow ear infections, and typically the majority of ear infections are about age 2.5 and under, and as the children get older, they typically have less and less problems with ear infections.
In addition to secondhand smoke, a surge in dual-career families during the 80s also meant more children in daycare, which meant more exposure to germs, colds, and infections.
And we see children all the time with different problems from being at school because they are so full of germs and different viruses, and of course kids share everything. They give each other kisses and hugs and all that good stuff. But the biggest advice to parents, I would say, is make sure that you teach your kids how to wash their hands. That's the most important thing, and having them not touch their face. And the more that kids can do that, the better off that they're going to be. And kind of promote hand sanitizers when you can. That way the kid can be as healthy as possible and not get through too many sick days that they have.
In addition to our reduction in secondhand smoke and better school and daycare hygiene awareness, researchers believe that a vaccination introduced in the 90s and an increase in the number of mothers who breastfeed may have also contributed to the 30% decline in the number of childhood ear infections. For more information about Lake Ear, Nose, Throat, and Facial Plastic Surgery and its treatment services for children and adults, click the ear infection story icon on our homepage at yourhometownhealth.com.